Hi, I'm Casey Glade, and this is my return demonstration for NR302, the cardiac section. Knock, knock. Hi, I'm Casey. I'm going to be your nurse today. I'm just going to start out by doing an assessment on you. It's going to take about 20 minutes, just so that I can get to know you a little better and take good care of you. I'm going to start by pulling the curtain for your privacy, and I'm going to wash my hands. Can you tell me your full name and your date of birth? All right, thank you. And do you have any allergies that I need to know about? No? Okay. And are you in any pain right now on a scale from 0 to 10, 0 being no pain at all and 10 being the worst that you've ever had? Okay, thank you. So I'm just going to start by going over your appearance. Everything looks consistent. I see you're in no signs of acute distress. Your facial expression is within normal limits for the situation. Mood appears positive. Speech is clear and easy to understand. Dress and personal hygiene appears within normal limits. And I know you told me your name already. Can you tell me where we are? All right, and can you tell me what month it is? Okay, and then can you tell me why you're at the hospital? All right, so patient is alert and oriented to person, place, time, and situation. Okay, so now I'm going to go over your skin and your nails. Color appears to be appropriate for ethnicity. Color, I see no signs of cyanosis, jaundice, erythema, or pallor noted. No lesions or wounds appear throughout that I can see. No incisions or piercings noted. I'm just going to feel your skin temperature. The back of my hand. Skin color or skin appears to be warm and dry throughout. I'm going to test your skin turgor. No skin tinting noted. The nail color appears consistent with the skin color. The shape and contour appears within normal limits. There's no signs of clubbing. Capillary refill, less than 3 seconds. All right, now we're going to go over your face, your head, and your neck. So first I'm just going to inspect your face. It appears symmetrical. The facial structures are within normal limits. I see no signs of drooping. I'm going to separate your hair here. Okay, I see no signs of infestation, no lice, no dandruff or ticks are noted. I'm going to look at your neck. The trachea appears midline. No goiter or masses are present. Okay, next is your eyes. So we're going to inspect the outside of your eyes first. I see no discharge or redness or lesions noted. Your eyebrows, eyelids, and eyelashes all appear within normal limits. The conjunctiva appears to be pink and moist. Oh, well, let me pull your eyelids down and let me see. Okay, good. So the sclera appears white, and the conjunctiva is pink and moist. Now I'm just going to look at your pupils. All right, pupils appear to be about 5 millimeters in diameter. They are equal and round. I'm going to shine this light in your eye and look at your pupils. All right, good. Okay. Pupils appear to be reactive to light. Now I'm just going to hold this object away and you just focus on it as it gets closer to you, okay? Okay, good. Accommodation is noted. Perla appears to be intact. Okay, next we're going to look at your ears. Just going to look at the outside. See no lesions or piercings noted. I see no discharge, swelling, or redness on the outside. Now I'm going to have you plug your ear and I'm going to whisper in your opposite ear and you tell me if you can hear it, okay? So go ahead and plug this ear. Good. Now you can plug this ear. Patient appears to be hearing appropriately. All right, next we need to look at your nose. I'm just going to look at the outside first. There are no lesions. It appears to be midline on the face, and it is symmetrical. I'm going to have you look up for me. Just going to look at the inside of your nose. I see no deformity, no asymmetry or inflammation is noted. Just going to look at your nostrils. All right. There is bilateral patency noted. Both nares are open bilaterally. I'm just going to shine this light in your nose. No drainage is noted. All right, next we're going to go to your mouth and your throat. So I'm just going to look at your lips. They appear to be pink and moist. The tongue, the gums, the buccal mucosa, and the palate all appear to be pink and moist as well. Your teeth appear healthy with no issues noted. And the pharynx appears to have no redness or drainage as I look inside. All right, so now we need to do your lungs. So I'm just going to look at your anterior chest first. I see no signs of accessory muscle use noted. So I'm going to go ahead and I'm going to auscultate your lungs. All right. So we've got right upper, left upper, left upper, right upper, right upper. And please take a deep breath in and out as I do this, okay? Right upper. Left upper. Right middle. Left upper. Left upper. Right middle. Right lower. And then left lower. Okay, I'm going to have you turn around to your backside, and as you do that, I'm going to look at the curvature of your spine. It appears within normal limits. I see no signs of scoliosis, no kyphosis or chordosis are noted. Your AP to transverse diameter is also within normal limits. So I'm just going to go ahead and I'm going to listen to the back side of your lungs. Take a deep breath in and out as I do this each time, okay? All right, we got the right upper, left upper, left upper, right upper, right lower, gotta make sure we're not on the scapula. We've got the left lower here, whoops, right lower here, right lower, left lower, left lower, and then right lower. Okay, good. All right, I'll have you turn back around. All right. And then we're just going to do the final part. I'm going to look at your heart now. So I'm going to palpate your carotid pulses first. Good. All right, good. I see no signs of jugular vein distension. I'm going to go ahead and I'm going to oscillate your heart sounds. First with the diaphragm. So I'm going to go first, I'm going to go to the right second intercostal space, which the clavicle is here. So I'm going to feel space, I'm going to feel a rib, and then here would be the second intercostal space. So I'm going to start right there, and that's my aortic. I'm going to go straight across to the left side, and that is the pulmonic. I'm going to feel here, here's the rib, so I'm going to go right below that, and we're at the third intercostal space. We're at Erb's point right now. And then I'm going to feel underneath is another rib, so we're going to go down to the fourth, and we're now at the tricuspid. And then I'm going to feel down one more time, and we're with the midline of the nipple now. And we're going to hear here the fifth intercostal for the mitral. Now I'm going to switch. We're going to do it with the bell. So here's the clavicle, a little space. We got the first rib, and then we got the second intercostal space. So I'll put my bell over here, and we're at the aortic again. I'm going to go straight across the sternum over to the second intercostal space. Now we are at the pulmonic again. I'm going to feel here, I feel a rib, so I'm going to go right underneath that. We're now at Erb's point. I feel underneath here there's a rib, so I'm going to go underneath that. We are now at the tricuspid, and then I'm going to feel a rib under that, and then there's another spot here, and here we're at the mitral, mid-clavicular line. All right, great. So your heart sounds good. The last thing I need to do is just palpate your radial pulse. So I'm going to do this one. Good. And then I'm going to do this one. All right, great. Okay, well, that'll do it. Thank you very much.